In this second part, we will cover more advanced medical coding interview questions that interviewers commonly ask to assess real-world understanding. Question 13. What is downcoding? Downcoding occurs when a code with a lower level of complexity or reimbursement is assigned instead of a higher level code that may be supported by documentation. This usually happens to avoid audits or when documentation is insufficient. While downcoding is not fraudulent like upcoding, it can still result in revenue loss for healthcare organizations if done incorrectly. Question 14. What is the difference between inpatient and outpatient coding? In inpatient coding, the principal diagnosis is determined after reviewing the entire medical record and is the condition chiefly responsible for the patient's admission. In outpatient coding, the first listed diagnosis is based on the reason for the visit at the time of encounter. Inpatient coding follows stricter sequencing rules compared to outpatient coding. Question 15. What is an unbundling error? Unbundling occurs when separate codes are reported for procedures that should be built together under a single comprehensive code. Coders must follow National Correct Coding Initiative or NCCI edits to avoid unbundling errors. Question 16. What is the National Correct Coding Initiative or NCCI? The National Correct Coding Initiative is a program developed to promote correct coding practices and prevent improper billing. NCCI edits help identify code combinations that should not be built together unless appropriate modifiers are used. Understanding NCCI edits is essential for accurate and compliant coding. Question 17. What is a query in medical coding? A query is a formal request sent by the coder to the healthcare provider for clarification or additional documentation. Queries are used when documentation is incomplete, unclear, or conflicting. Proper querying ensures accurate code assignment and compliance with coding guidelines. Question 18. What is the difference between coding guidelines and payer policies? Coding guidelines are official rules published by organizations such as ICD and CPT that govern how codes should be assigned. Payer policies are specific rules set by insurance companies that determine coverage and reimbursement. Coders must follow both to ensure claims are accepted and paid. Question 19. What is risk adjustment coding? Risk adjustment coding is used to reflect the severity of a patient's condition, especially in chronic disease management. It ensures that patient complexity is accurately captured, which impacts reimbursement and population health analysis. Accurate documentation and coding are critical in risk adjustment models. Question 20. How do audits impact medical coding? Audits are conducted to review coding accuracy and compliance. They help identify errors, improve documentation quality, and ensure adherence to regulations. While audits can be stressful, they are important tools for maintaining ethical coding practices and preventing fraud. Question 21. How do audits affect medical coding? Audits review coding accuracy and compliance and help identify errors and improve documentation quality. Question 22. What is the difference between ICD-10-CM and ICD-10-PCS? ICD-10-CM is used for diagnoses while ICD-10-PCS is used for inpatient procedures. Question 23. How do you stay updated with coding changes? By reviewing annual guideline updates, attending training sessions, and following coding newsletters and professional forums. Question 24. Why is attention to detail important in medical coding? Small coding errors can lead to claim denials, audits, and compliance issues, making accuracy critical. Question 25. Why should we hire you as a medical coder? A strong answer highlights accuracy, knowledge of guidelines, ethical coding practices, and willingness to continuously learn. Question 26. What would you do if a provider documents a diagnosis but does not meet coding guidelines? If a documented diagnosis does not meet coding guidelines, the coder should not assign the code. The correct approach is to review the documentation carefully and query the provider for clarification if needed. Coding must always follow official guidelines, not assumptions. Question 27. What is the difference between coding guidelines and coding conventions? Coding guidelines are official rules that explain how codes should be selected and sequenced. Coding conventions are instructional notes such as includes, excludes, and code first that appear in the code set and must be followed during coding. Question 28. What is an excludes one note? An excludes one note indicates that two conditions cannot be coded together because they are mutually exclusive.